Hi, I'm Dr. Rena Azar, and I'm going to talk with patients about laparoscopic assisted vaginal hysterectomy, just to give some general post-operative instructions and information. As you know, laparoscopic assisted vaginal hysterectomy means that you should not be receiving a large incision on your abdomen. I generally do 3 little incisions about this big, half a centimeter. Occasionally, if you have a lot of scar tissue or a difficult anatomy, for example, because you have an enlarged uterus from fibroids, I may need to use different incisions or different number of incisions. So I do most of the work from up top while I'm inside your abdomen. I will clean up endometriosis, scar tissue, always take a look at the other parts of the abdomen, try to see the appendix if it's visible, the liver and the stomach, as well as the intestines as much as I can. There are a lot of those in there. And then I go down below to take the uterus out down below. And in doing that, you will have just the 3 upper incisions generally, like I said, at the belly button and 2 in the midline down below. Those incisions are all waterproof from the minute you come out of the operating room, as is the vaginal area. So I tell people that after surgery, you're going to get scheduled pain medicine. You'll get a pain pill about every 3 to 4 hours, depending on how much cleanup work I had to do in there. And I have a pretty good idea of what will hold you pain control wise, but while you're in the hospital, we'll make sure to sort out what works for you for pain control so that when you go home, you'll get the same medication. It is not fun for loved ones to go back and forth to the pharmacy trying to get the right type of pain medicine to help people. Likewise, when you go home, make sure that whoever picks up your medication gets all of it, including the pain medication. So in the hospital, you'll have an ice bag, and post-operatively, it will be helpful. It's not mandatory, but it's very helpful to keep an ice bag on the outside of your bottom. That is an area where I've done some work, and it will have a tendency to swell, and the ice helps to keep that swelling down. Mostly important the first day of surgery, not so important afterward. If it feels good after that, fine, you can do it. But if it doesn't feel particularly good, you can discontinue that after the first 12 hours post-operatively. Most people go home the next day. I like to keep people overnight so we can work on pain control, make sure you're not one of the few people that gets nausea and vomiting post-operatively. We used to see a pretty high incidence of post-operative nausea and vomiting related to anesthesia. I would see maybe 15 to 20% of people would have that. However, we have new medications that we've started using in the last few years that are very effective at preventing that. So if you have nausea and vomiting post-operatively, however, I will be giving you some medication to go home with for that as well. Post-operatively, in the hospital, you'll be advancing your diet usually the next day. If you're really, really hungry the night of surgery, tell the nurse, she'll call me, and I can let them advance your diet if you would like to, as long as everything looks good, your vital signs, and everything is looking stable. The next morning, after you've had your catheter out and you urinate no problem, I do leave the catheter in overnight, mostly because people like the rest. We do a lot of intravenous fluids perioperatively during surgery and before and after surgery. And if we take you out of the OR without a catheter, you'll have to get up frequently to urinate. And I like people to rest that first night, especially. So in the morning, you'll get your catheter out. They'll get up and walk you around to make sure that you're comfortable enough to walk around, to make sure that you're stable enough, you're not dizzy or having other symptoms that are problematic and keep you from being safe while you walk around. And if you are doing that and you're able to urinate well enough on your own, I do get an occasional patient whose bladder gets sluggish after surgery, and we have to decide how to deal with that if that's the case with you. But keeping people to the next day can help reassure me that then when they go home, they're going to be urinating fine. Once you go home, I like you to take your pain medicine the first week the same way we give it in the hospital, which is generally every 3 hours or every 4 hours scheduled. In addition to that, it's important to know you will be waterproof. You can get your abdomen in its entirety wet. You can get in the bathtub, whatever feels good for you. If you feel like you're having some problems emptying your bladder, getting in the bathtub is probably the best thing you can do. Get in the bathtub, soak, and the bladder loves to wake up in the presence of hot water, as most parents know. So you're waterproof. You can have a regular diet when you get home. We do like to make sure before you leave that you are tolerating food adequately and we feel comfortable that you can go home and you can eat. Once you get home, I do tell people it's good to avoid spicy and greasy. because those things are a little bit harder on the stomach, especially after having all the medications that we give around the time of surgery. Take your pain medicine schedule the first week. Get lots of rest. I tell people, even if you feel good enough to get around and do jumping jacks and wash your floors, etc., don't do it. I really find that the people who rest that first week, they bounce back. In other words, their pain level falls off a lot faster. They're feeling better 2 weeks out than somebody who didn't rest the first week after surgery. And I think that's attributable to the fact that you can only heal once. And if you don't do it right the first time, you can't go back and get it. It's a little bit like sleep. If you don't get a good night's sleep, it's pretty hard to capture that back. So let your healing be as optimal as it can be. Go home and get lots of rest. Tell your loved ones, not going to be doing much that first week. Just going to be eating, using the restroom, showering and bathing, and other than that, just resting. I tell people you do not have to be in the bed, but lazy boy, recliner, sofa, etc. will do lots of rest that first week. Then you can taper off your pain medicine. We'll usually see you about a week out from surgery. And about a week after surgery, you can start tapering off your medication. First, take it as needed, and then just taper it down. And then you can start increasing your activity. I do like no heavy lifting. My preference is not heavier than a gallon of milk, so that's about 7 or 8 pounds. And that's because I like to make sure that everything that I've reattached to the vaginal area after I remove the uterus will stay there and get healed well, so that you have good support of your internal organs. I am a pelvic floor reconstructive specialist, and I don't like to have to go back later and redo things. So I think my low reoperation rate is both because I try to do a good quality surgery. I do reattach ligaments, etc. But I also ask my patients to be good and mind my advice to not do any heavy lifting the first 6 weeks. Intercourse also should be avoided the first 6 weeks post-operatively. Occasionally, if somebody's really eager to increase their activity level a little bit earlier than I usually desire in those two senses, I'll have them come back in and examine them to see how they're healing, make sure things are healing well. And if they are, then occasionally I'll let people return to those activities a little bit early. So this is my instructions for post-operatively. The only other thing I would add is I do give antibiotics around the time of surgery. Probably a good idea to take some probiotics after surgery to kind of help the bowel bacteria to recover from the antibiotics that you get around the time of surgery. I like to tell people post-operatively, since you've received this video, this comes from my cell phone usually. And if you have a post-operative related problem, I tell people maybe don't call me directly about annual refills on things. That would be overwhelming for me. But if you have a surgery related question, I really want you to call and run it by me. Text me or call me on the number that you received this on, and then we can make sure that we can be on top of any problem you might incur. If you have problems post-operatively like nausea, vomiting, increasing pain instead of lessening pain, vaginal bleeding, or anything concerning for you, I would like you to run that by me. And I hope you find this helpful. And probably I'll be seeing you soon.